Hi, I'm Dr. Bailey. If you received a link to this 3.5-minute video, it's because your exam or x-ray findings reflected a loss of the normal curvature in your neck. This video will provide you with valuable information that will help you to better understand your x-rays when we review them with you on your next visit. This x-ray is a side view of a normal neck. This is the jaw and this is the back of the head. In a normal healthy neck, you should have a good curvature like this. Notice how all of these vertebrae follow this curved line here. Gravity is always pushing down on your head, and when you have a good curvature in your neck, all the weight comes down and rests on these joints right here called the facet joints, and they carry the weight of your head like a spring with no problem. This is a side view of someone who has lost the curvature in their neck. The red line represents where their neck is, and the green line is where it should be. When you lose the curvature in your neck, it is bent forward, and then the muscles that run from your upper neck here to your upper back have to work harder to hold your head up all day. It's like holding a bowling ball away from your body versus holding it close to your body. The muscles are going to strain and fatigue. Another reason that a lack of curvature in the neck is a problem is that as your neck bends forward, it puts more strain on the front of the disc here. And when this occurs, it can cause the disc to wear out faster and deteriorate. I'm going to show you what the progression of this deterioration looks like. This again is a normal neck and wide healthy discs. In phase 1 of this process, you lose the curvature in the neck, and this is where the disc strain begins. In phase 2 here, you'll notice the discs are getting narrower and the spine starting to develop bone spurs. In phase 3, you'll see that some of the discs are fusing together and there's massive amounts of bone spurring and degeneration. Initially, the body lays down bone spurs to help strengthen the weakened disc. However, over time these bone spurs can become problematic because they can put pressure on the nerves, like you see here, or pressure on the spinal cord. When these bone spurs put too much pressure on the nervous system, the condition requires surgery. Additionally, if there's too much pressure on the front of the disc here from the loss of curvature, this can also lead to disc herniations. This is an MRI, and again, the increased pressure here will cause the disc to bulge out in the opposite direction, just like the jelly would in a donut. In this case, the disc is hitting into this structure here, which is the spinal cord. A researcher at the University of Southern California concluded that a loss of neck curvature, depending on the severity, can add up to 30 pounds of abnormal leverage on the spine and can reduce lung capacity by as much as 30%. Lack of oxygenation from this condition is asymptomatic in some. However, there are others who may experience loss of energy, headaches, anxiety, lack of mental clarity, and other symptoms. A loss of the cervical curve is still very correctable in the earlier phases, but is less correctable if the condition becomes too severe. It is good to correct it as soon as possible to prevent further damage. On your next visit, we'll be going over your x-rays, and we'll show you something simple that you can do at home in addition to the chiropractic adjustment to help you correct this problem.